Hi, my name is Dr. Arnold and welcome to Lancashire Smiles. And in this video, I want to talk about how I've ended up becoming a cosmetic dentist, dealing with smile makeovers, smile transformations, and how that all unfolded all the way from my foundation year as a dentist, newly qualified out of the University of Central Lancashire. So I graduated out of the University of Central Lancashire, the dental school there, not really knowing which direction my dental career was going to take. And during my foundation year, one of the key moments was when my supervisor allowed me to see him handle one of the cases. It was an Invisalign case, and little did I know that I was gonna use Invisalign in the future to treat a majority of my patients when producing their smile makeovers. So during my foundation year, I decided to go on the course, the Invisalign course, become a provider, and the course then made me certified to start treating patients using the Invisalign system. And the good thing was, in that year, that foundation year, because my supervisor also carried out Invisalign for his patients, he was able to supervise me in my first few cases. My first patient, shout out Dr. Syra, was a fellow colleague who was also a foundation dentist. So that gave me a perfect opportunity to learn and really get used to the Invisalign system as a means of straightening teeth. For those of you who may not know, Invisalign is simply a system that's used to straighten teeth. So it's these clear trays that patients change every 7 days, every week, putting these gentle forces on the teeth until they're straighter. And this goes on for what maybe 6 to 8 months until the desired result, positioning of the teeth is achieved. Once the positioning of the teeth is achieved, it then opens up other cosmetic treatment that patients can have. So once the teeth are where they should be, it might be that patients want to alter the shape of their teeth to give a more perfect smile. So it might be that they now want a celebrity look, or they want to have some veneers or some composite bonding to enhance their smile, beautify their smile. So because the teeth are in the position they should be, it means that any cosmetic work carried out on the teeth will last longer and will look better, and you'll be able to provide that treatment in a minimally invasive way. So you might have heard of the terms align, get the teeth straight, bleach, whiten the teeth, and composite bonding or contouring, the ABC, align, bleach, and contour. So that's where this starts to come in handy, having the skill and the ability as a general dentist to use a system like Invisalign to straighten your patient's teeth. It opens up other treatments that patients want. For me, what I liked about using the Invisalign system was the fact that I was able to give patients a straighter smile, straighter teeth, and it was a treatment that patients looked forward to having. You know, they came into the practice looking forward to their Invisalign visits, looking forward to seeing me and progressing with their treatment. So for me, it was one of the treatments that allowed me to provide an elective treatment that patients wanted, that patients enjoyed the process, I enjoyed the process. So it was something that I wanted to do more of. Another thing with Invisalign is you might be an Invisalign Go provider or an Invisalign Full provider. Now, the difference between these is, as an Invisalign Go provider, you're taking on cases which are mild to moderate, Whereas as an Invisalign full provider, you might be taking on more severe cases that are sometimes usually taken on by specialists, and maybe you've got a lot more experience within orthodontics and you take on more difficult cases. So Invisalign full would enable you to treat those type of cases using the Invisalign system. But for myself, I wanted to treat mild to moderate cases. I was happy doing that, and I progressed through the statuses year on year. When you become an Invisalign provider, you automatically become a certified provider. Now, the next step is becoming a preferred provider, and that means that you've taken on 12 cases. After you've become a preferred provider, if you take on about 25 cases, you then transition into premier provider. If you take on 50 cases, you transition to become an elite provider. And all this means is that you've had more experience carrying out Invisalign, you've done more cases that year, and Invisalign will reward you in reducing the lab bills, so the cost that they charge you to use their system. So there is a point system which Invisalign uses to determine your status. So it might be that you become a preferred provider, so that's 600 points that's needed to become a preferred provider. And for simple cases, you get awarded 50 points. So 12 simple cases would give you the preferred provider status. If you take on moderate cases, you'd be awarded 80 points. So it's quicker to get to that 600 point mark of becoming a preferred provider. To get to the premier status, you'd need 1,250 points. So if you were going to carry out simple cases, you'd get 50 points. You would need to carry out 25 cases in order to get the premier status. To get the elite status, you'd need 2,500 points. So you'd need to carry out 50 simple cases in order to get 2,500 points. And of course, if you're carrying out moderate cases with the Invisalign Go system, you would reach that point much quicker, because with moderate cases, it's 80 points. Within 4 years of using the Invisalign system, I've been fortunate to actually reach the elite status. So for myself, I actually ended up treating more recently over 100 cases within a 1 year period. And what I found out was I was in the top 1% within Europe and the Middle East as an Invisalign Go provider. So a new status has recently been made, which is the Elite Apex status. And again, it's just some nice recognition from Invisalign that I've been using their system and transforming so many patients' smiles with it. On this journey where I've been becoming more experienced using the Invisalign system, I found that it's opened up a lot more treatments to my patients that I can start to offer. So composite bonding, veneers, shaping my patients' teeth to beautify their smiles now that their teeth are in a straighter position. And I found that that's brought me more into cosmetic dentistry. So from a place where I wasn't really intending to go to cosmetic dentistry, I was just following a path where I enjoyed carrying out orthodontic treatment, and that led to me now becoming more exposed to cosmetic cases, and I'm actually enjoying it to the point that I'm doing more courses that are to do with composite bonding, as well as taking on extra courses to do with orthodontic treatment, fixed braces, metal braces. So I guess the learning point and advice that I would give to anybody that's starting out within dentistry is the fact that if you think about what you're enjoying and you do more in terms of courses that you enjoy, it may lead to a path that you would never originally have thought of from the start, but you may end up in a path or in a position where you're carrying out dentistry you love and dentistry that you never knew that you would love to the extent that you do. So that is how I ended up becoming a cosmetic dentist. And if you want to find out any other information about my journey, simply ask in the comments section You never know, I might do a video on that. Make sure to like the video, share the video, subscribe, turn on the notifications, and I'll see you guys at the next one.